Hello, and welcome to the Truth Words podcast, where we discuss the details of natural solutions for chronic health conditions. I'm Natalie Kasana, and I'm so happy and grateful that you are listening. I hope you will enjoy it or get something useful out of this series. In this episode, you'll hear about Dr. Céline Peters' experience resolving PCOS and infertility, as well as many other chronic conditions including depression, insomnia, fatigue, and UTIs using natural solutions, and all the details of what worked and what didn't work for her along the way. I'd like to start by noting that the views and opinions shared during this podcast are my own and do not reflect the views of my employer or any affiliated organizations. That equally applies to any guests that may appear on the podcast as well. Additionally, because we will be talking about health topics, I want to make clear that I am not a licensed healthcare professional, and any advice shared on this podcast is not meant to be a substitute for professional medical advice, nor a guarantee that the same results would be seen by anyone else. I would always encourage anyone to seek the opinion of a healthcare provider before trying any possible healing paths. It is important to establish a clinical diagnosis and assess possible risks or interference with current medications. Welcome, Céline, to the Truth Words podcast. Thank you so much for joining me today and for being willing to share the details of your healing journey.
Oh, thank you so much, Nelly. I'm really grateful to be here. Thank you for inviting me.
I'm so intrigued to hear the details of how you were able to cure or get through multiple different chronic conditions using natural solutions, and also how you've been able to incorporate alternative methods or practices into your work as a doctor to help others find healing as well.
Yeah, let's talk about that today.
Absolutely. Can't wait to get started. I usually start by asking people about the beginnings of their symptoms and things like that, but I was actually wondering if you might be willing to share a bit about your training and your education as a doctor, just to kind of set the stage for our listeners, because I feel like it's so valuable that you have that scientific and clinical background when you're talking about your own symptoms and your own experience as well.
Oh, yeah, absolutely. So I don't know whether it's the same in the US. I think it's probably a bit different, but in the Netherlands, where I'm from, we have a 6-year education, which trains you to be a medical doctor. And that means you're not specialized then. That's just like a regular MD. And so I finished that afterwards. It's common here to have some work experience. I think probably similar to maybe residencies, for example. And so I worked in the ER unit, and I've worked in a psychiatric hospital for eating disorders for a while. And afterwards, I started training to become a GP, which is 3 more years in the Netherlands. That's my clinical education as a doctor.
Wow. I also was reading on your website that you've done additional certifications in some holistic practices as well. I think I was reading about hypnosis.
Exactly. Yeah. So actually, I'm trained as a full hypnotherapist, and I don't use it as much formally in hypnosis sessions anymore, but I use a lot of components from that in my everyday consultations.
To start on, your own story and your own healing journey, can you describe a little bit at a high level, what were your major symptoms that you were dealing with personally? And at a high level also, what ended up being the type of natural solution that was most effective for you?
Yes. So I think when we start at the beginning, actually from my childhood on, I had a lot of depression. Yeah. So that was something I suffered from, but actually I managed pretty much. When I was 15, I got mono, a story that many will probably relate to, but I was really sick. And it took about 7 months before the doctors could find out what it was, because my first blood test, they didn't show any mono. And I started to get a enlarged liver and itching, and then the swelling started. So I got some really serious swollen lymph nodes. They were actually like kiwi size format, so really, really big. So yeah, I was actually visiting an oncologist at that point who thought I had Hodgkin's disease. So yeah, that was really stressful, especially for my parents. To be honest, I was so sick. I mean, I didn't even feel stressed because I was just too sick. And all of a sudden, the oncologist, he decided to do one last blood test. They checked everything, like from HIV to all exotic diseases you could think of because they just couldn't really diagnose it. Yeah, and then they found out that there was an extreme elevation of Epstein-Barr antibodies. And yeah, that's when they said, well, okay, now we know it's mono and yeah, we can't really do anything for you and just go home and rest. Yeah. So it's really strange, especially for my parents when, we visited a lot of doctors and there was a lot of medical attention. And then all of a sudden it's like, okay, my child is still very sick, but yeah, let's just go home and sleep it off.
Oh my gosh, in some ways it must have been a bit relieving that it wasn't something more severe. But on the other hand, then you're left with like, what do we do now?
Yeah. Yeah, because my parents were actually talking like, what if she needs a bone marrow transplant, or what if, if she would need chemotherapy? So they were really stressed at that time. I think the upside for me, like I said, I was so sick, I didn't really feel it being so serious because I just didn't have enough energy to think about that. So at that point, I think that was helpful for me. But then came a very long period of just being at home and like literally on Mattress Island. I think anybody that has dealt with serious chronic disease or with serious chronic fatigue will acknowledge like sometimes when the radio was on and I couldn't even lift my arm up to grab a remote control to turn it off, for example, really things you don't even think about when you're healthy. And so they're so normal. But then at that point, like, or that not being able to go outside for months, I think that's really impacted me from a young age on.
Absolutely. Wow. And then from there, did you try any other types of treatments or how did your symptoms resolve at that time? Or did you already start to try different natural solutions?
First of all, my parents, the oncologist who treated me, he did recommend to lower fats, which I think was really interesting, knowing what we know now with medical media information. And I can remember when he mentioned that, and even if I would have had, because I would eat high fat compared to what a medical medium lifestyle is, but if I would have had something, I could really feel my liver aching, it being enlarged. It was really putting pressure on my diaphragm. I always remembered that he mentioned like, don't do fats, your liver won't like it. So that was already, I think for that time, really quite progressive recommendation. And so first I just rested a lot. It started to become months and months. And actually my parents took me to a natural healer who worked with herbal supplements also. And she had something specific which would target Epstein-Barr virus. I don't remember what's in them, but I do remember that it improved a little bit. And somehow I was able to, go back to school and just sort of resume my normal life. From that point on, I did notice that I wasn't the same anymore. So the chronic fatigue, it stayed, not in a way where I was bedbound. And I could go to school and I could do other things, but I really noticed that I needed a lot more recuperation time from doing something. Or I went to parties and I did things normal teens do. I would always need to recover from them.
Yeah, because usually young people can kind of just run on empty for a long time, stay up late and keep going. But it sounds like it was really hard for you even to recover from that at that
Yeah,
age.
exactly. Yeah, and then I really had a big desire to become a doctor, and I really wanted to finish my high school and started medical school. And in the Netherlands, you have a system. If your grades are high enough, you can just enter. If your grades are not above a certain level, what happens is then you have to sort of do a lottery to see if you can become a doctor. And I didn't have a plan B. I knew I wanted to do something with healing. I didn't know in which specific modality, but I knew I wanted to become a doctor. So I tried to do 2 years in one and still get the average I needed to get in without having to do the lottery. I don't really know how I did it with the chronic fatigue, but somehow I managed to do that because I just really wanted to think I put my head in the sand for quite a bit. I didn't want to acknowledge I had symptoms or I was ill. Yeah, so then I got in. Luckily, everything worked out the way I'd hoped. And during medical school, I sort of totally ignored that I had symptoms and I really treated my body quite poorly. I went out to the middle of the night in the morning, got back to class. I drank a lot of coffee. I even used energy drinks. If we had an exam that would last for 4 hours, I just couldn't stay awake otherwise. I don't really know, looking back, how I did that all. But yet somehow we just managed. But then along the line, I started to notice much more symptoms coming up, like interstitial cystitis. I had a lot of UTIs, which was really painful. I got some sleeping issues also, was terrible insomnia. I could not fall asleep, which made it really difficult. Then the depressions also started coming back again. And I think it's probably because of really abusing my adrenals with the way I studied and partied and just pretended nothing was wrong where there really was.
Wow. I can relate to so much of that, pushing yourself so hard to like get through something and then afterwards wondering why it takes you so long to recover and feeling so awful. It's really hard.
Exactly. Yeah. And so I think that went on and I started working and some other symptoms came up, like a lot of digestive issues. I was not officially diagnosed with IBS, but I would have diagnosed myself, like complaints. And, when your blood tests are normal, I mean, I was a doctor myself. I thought I can go to the doctor, but then she will just tell me, it's in my head, or you get this diagnosis or label that means nothing. So I didn't visit there. But yeah, I had a lot of bloating as well, a lot of cramping, a lot of pain.
May I ask a question there? So I was so curious after your experience of having been diagnosed when you were young with something that was not able to be treated by conventional medicine, and yet you were still intrigued to learn everything that there was to know about conventional medicine. Did you see it as like a baseline, and then from there you would try to figure out what's unknown yet? Because just now you're mentioning how you didn't even want to go to the doctor yourself because you knew they wouldn't have an answer. I'm just curious your motivation there.
Yeah, no, I can understand that might sound really contradicting, but I actually also have a very strong spiritual connection to what I would probably call angels or like however you want to call it. I always heard them saying you need to go to medical school and this will get you to where you want to go in the end. And so I've always followed that their recommendations or their guidance is probably a better way of wording it. And it's always led me to great places. So somehow within my core, I knew that was a route I had to take. But I also knew from the first day I started training to become a GP, I knew this wasn't what I would be doing for the rest of my life.
That makes a lot of sense. It's like you need to get a basis of what's known out there already in order to build upon it for things that are as of yet unknown.
Exactly. And I also think I'm really grateful for everything I've experienced as a doctor because I got to see a lot of patients with different illnesses. I got to see how they impacted them. I got to learn what does it happen if people are on this antidepressant? How can they react when we wean them off? How does this look like? And I think that helps me so much with the work I do today. You can recognize patterns so much easier. And then, yeah, if you want to implement some certain protocols or give some recommendations, I think because you're really aware of what you're treating, it helps so much.
Absolutely. And just being aware, like, let's say if you're working on something that's diet related, like you're saying, what the side effects might be or what the interactions might be, and being mindful of those. There is a lot of inherent value in current conventional Western medicine. And it's like the combination of the two, I think, can be the most ideal situation because I know just from my own personal experience, even when I was working on things diet related, if there was some sort of urgent situation with one of my kids, I was always so grateful to have conventional medicine available, or like when I was giving birth to my kids or whatever. So there's that value of both. It's just figuring out, I think, the best or correct place to use each one. Would you agree with that?
And I think sometimes people that are more into holistic health or natural health, they can sometimes be really wary of regular medicine. Obviously, I don't agree with all of the treatments that are given. But then again, there is an inherent value to it. And sometimes even in my practice, sometimes I do recommend patients to start medication. If they are so depressed, they cannot get out of bed, cannot start taking care of themselves, not juicing celery, and they don't have a network who can help them, then sometimes I'm really grateful these medications are there. Or when someone is in a serious thyroid crisis and just we need something to calm it down, or with arrhythmias, for example, I'm really grateful that regular medicine does exist. Apart from having an accident, breaking a leg, needing a cast or something like that. I think sometimes, yeah, it's really helpful that we have that. But in the end, it's also about that sort of more like acute care where we would need that. Whereas I think ideally we would have treated the patient before it getting to that point, or we would have gotten their immune system up to a certain level so the kid wouldn't get a ear infection or they wouldn't get a pneumonia or whatever else. So I'm really all for regular medicine, but not as the only thing to do. So it sort of helps in the moment, but there are underlying things that we still have to take care of, even when regular medicine tells us, well, this is it.
Absolutely. So let's dive a little bit into how you ended up coming across the information that you ended up using to heal yourself using natural solutions and what that was.
So what happened when I was dealing with the chronic fatigue, I think I've tried every alternative modality you can think of, like from reflexology to acupuncture to really anti-inflammatory diets to fasting. So everything you can imagine, I tried doing because I just felt that there was something really wrong in my body, but nobody could really tell me what it was. I looked everywhere, but I never really found any lasting results. We got to an age where my husband and I wanted to start a family. And actually, I didn't have a cycle for quite a few years. And also, there, I think I just ignored all the red flags, ignored all the signs. So I just attributed it to stress. Whereas, actually, when I went to see a gynecologist, she diagnosed me with PCOS. She mentioned that I was infertile with the PCOS I had and that I would never become pregnant naturally. Yeah, so then I got home and I was really, really sad, obviously, as you can imagine. Yeah, I was literally on the ground crying. And then once again, and people may believe this or not, which is fine, but there was literally a ray of light coming through our window and it shined upon the book of Anthony William and gave it to me like years prior because she told me, well, Celine, this is a book and it's about the virus you had when you were really sick, remember? Yeah, maybe it's something you can do it. It's not something I can read so easily, but you will probably understand it. And so I had the book in my house. Yeah, I just never got to opening it up until that point. And I started reading, and I think I read until like in the middle of the night. I just read it all through at once. And I was like, this is my story. Yeah, fast forward. I mean, in the beginning, I had a little bit of difficulty with implementing all the recommendations because I was so conditioned by regular medicine. So it was really difficult for me to get pregnant, but I should be having a lot of dairy, for example, because that's what they do recommend. And it took a little bit of time, but when I really started it, within the year, my fatigue was to a level I've never experienced ever since my 15th. I was pregnant within the year, and which was actually crazy to think of.
Oh
So
my
it was
gosh.
fast. And I think in hindsight, probably maybe a little bit too fast. My body wasn't really ready for the lowering of my immune system, which happens during pregnancy. But yeah, we've wanted to conceive for so long. Yeah, I was still really grateful with the way it happened.
My
Yeah.
gosh, I got shivers when you were telling me that story. The way you
Oh,
like come across what you need when you need it is just
yeah.
incredible.
Yeah. And so I think I feel really blessed. So even when I had difficult times or when I was having episodes of depression, I always had this sort of guidance like, hang in there, someday it will be different and there's more in the future for you. And that really did keep me going.
Can you share a bit about the details of the solution that you started to implement? You know, let's say, what diet changes you made right away versus what you kind of saved a little bit for later, and how you progressively were able to implement that in your life?
Yeah. So I was already eating a fairly clean diet. As I've mentioned, I tried all modalities. So I was already doing a lot of fruits, a lot of vegetables. But where people would tell me like, oh, this gives me such a big burst of energy, I felt nothing. So I started doing celery juice, and I actually have this really old centrifuge. It wasn't even a slow juicer, but that was what I had, and I started with that. And immediately from the first sip on, I felt something happening in my brain and it was like it switched on. And from that point on, I was really hooked. I just felt like my body wants this and it really needs it. So I started doing celery juice every day. Yeah. And then I started implementing lemon water as well. But I still, at that point, ate things that would not be the best in terms of what is recommended. So then I quit eating eggs and dairy, which can be really inflammatory. And especially for PCOS, eggs can be really detrimental. And I think that helped me a lot. Gluten took me a little while, but I also felt a sense of praise for myself. I thought, well, let's just like progress and just give myself little challenges. Once I've mastered this, then I'll start looking into gluten and then really having a fairly clean diet. I started implementing a specific smoothie, which can extract heavy metals from your brain and also from other parts of your body, like your liver, which really helped me a lot, especially with my depression. I remember, and this was also within the first year, at some point, it felt like something was pulled out of my brain. And all of a sudden, from that point on, I never had a depressive thought anymore, which is crazy. And I thought, wow, is this how other people perceive life? This is really not as difficult as I thought it was. And I think that's the most interesting thing. So sometimes in healing, you feel like nothing is happening, nothing is happening. And then all of a sudden, a big symptom shifts. And obviously, I did have a lot of progress in the beginning, but that was a really important thing for me. So I think next was I started supplementing B12, and that was really a game changer for me.
And then how did you, let's say, change your diet, or what did you eat instead to replace some of these things that you removed?
Yes. So I would start my day with having half a liter of lemon water, and then I would wait a little bit so it could actually flush my liver, because when we are sleeping, our liver is processing all sorts of waste and like from normal metabolism, but also from our immune system. And when we have low chronic viral infection or low grade bacterial infections, our immune system gives a lot of die off, both pathogen die off, but also viral neurotoxins, bacterial cells that have to be cleaned up, actually. And so I started doing that. And then I waited a little bit. Then I did the celery juice. Celery juice can be really helpful also to kill off pathogens. It actually has a specific molecule which can penetrate the cell wall and just make sure that the pathogen dies and our immune system can just clean it up. And then after having that, I would have a big fruit smoothie with specific ingredients, for example, like spirulina and dulse and cilantro in it, and wild blueberries and barleygrass juice powder, quite specific ingredients. And I would add that with banana and with orange, which is really delicious. I mean, it looks quite intense, but it's really delicious, actually. It tastes like a blueberry banana smoothie. Yeah, so I would have that every day, and I would snack on a lot of apples. So it's quite a high fruit diet, and it's quite low on fats. And then I would, for example, for lunch, have things like salads with sweet potato, or I bake muffins, for example, but then with oats, which were gluten free, with a lot of fruits, and obviously there was no dairy in them, no eggs in them. Yeah, or I would have more smoothies, or like even in the beginning, I had some gluten free crackers with some guacamole on it, which was quite simple but still really healing. And then at night, I had a few recipes like from some green curries, which I could make, but all plant based. So I did quit animal protein quite soon in my healing process. And I think that has also helped me a lot specifically. That's not something all my patients have to do mandatory. If people want to eat meat, they can. But for me personally, I think that has helped me a lot on my journey. I had some pasta dishes I could make. I eat a lot of potatoes, which are like my best friends now. It's because they taste so good and they're really satiating in this diet. So yeah, that was pretty much what I did.
And did you face any challenges in your own, let's say, cravings for things you used to have, or just like the time it takes to prepare all of this? What were some of the challenges that you faced when you were first implementing it, and how did you resolve them?
Yeah, so I think my biggest challenge, actually, in the beginning, it was cheese. My father is French, So I was raised with a lot of like really, really good French cheeses. And that was difficult in the beginning. But actually, when I completely was off that for, I think, about 2 weeks, it was fine. So in the beginning, it was intense, but afterwards, quite quickly, that would resolve. I think what was really difficult for me in the beginning was lowering my fats and lowering salt, because when we have poor adrenal health or adrenal fatigue, if we consume either fats or salt or things like caffeine, which I will get into in a bit, our adrenals sort of whipped into working even harder. They have to produce more adrenaline, so we feel a bit better in the moment, but in the end it will keep us stuck in a fatigue cycle. But then in the beginning it just was almost impossible for me not to have that. So I really needed that. And then I noticed slowly over time I was able to do less fats and do less salt, progress in that manner. But I think what was most difficult for me actually was quitting coffee, because as I've mentioned, that was what got me through my education. I remember some friends would even jokingly tell me like, oh, if Celine is in the party, she always has a can of energy drink in her purse. If you compare to how what I recommend people now and what I do, that seems like an unbridgeable gap. But yeah, that was what it was.
I can relate to that so much, and I actually really appreciate you sharing those details because, as you may know from some of the episodes I've shared already, I also have followed a very similar diet for my baby's eczema for the past, I don't know, 3 or 4 years I've been doing this. But I'll be honest, I have not quite quit caffeine until just about 2 weeks ago when I really felt like I felt so burnt out. I was like, I don't think I can tolerate this anymore. And I stopped and I felt a lot better, but it was very, very hard for me to stop that for a very, very long time with work and kids and just trying to manage it all. And the fats piece as well. I feel like even that I'm still, working on, but I can really hear what you're saying about the adrenals needing a break. And you're inspiring me to kind of take it to the next level now.
No, but I completely understand, and I really feel what you're saying. So it was impossible for me to do it in the beginning. And mind you, I got pregnant within the first year of my healing journey, whereas I had some really serious condition. So when during my pregnancy, I got such a big flare up of all my symptoms, and I actually had to be hospitalized at the end of my pregnancy because I couldn't sleep for days on end. And yeah, it was actually quite traumatic. And obviously, in the end, I would do it all again because I got my beautiful son from it. But yeah, it was really difficult. And then all of a sudden, you're like completely exhausted and you have a newborn to take care of and you have to nurse him so many times a day. And I just couldn't survive without coffee. And in the Netherlands, it's common to go back to work 3 months after giving birth. And during that time, I thought, I don't know what I'm doing here because I was still waking up 3 times at night while dealing with chronic fatigue. So, I mean, I couldn't quit caffeine at that point. But in the end, like over time, it got better and better. And up to a point where now, if you would tell me I could never have any salt or fats or coffee, and I haven't had coffee for for a really long time. So I think for about a few years now. And I'm really, really grateful. But yeah, even walking past a coffee shop, I could even, smell it. And I was like, oh, it still smells really good. But I mean, it's just not worth it anymore. Because what you are explaining, I mean, we think it gives us energy, but it's actually draining us. It's draining our minerals and it drains what we need to feel good. So in the end, if you break the cycle, then you can actually, exist on your own energy. And I think that's much more in line with what our body wants.
I think, so many times I tried to stop caffeine out of like a discipline. And
Exactly.
this time it was out of a necessity. Like I felt like my nerves were burnt out. I was almost getting like scared to have caffeine because I was like, I'm going to feel too awful. So it's almost like your body drives you to a point of necessity where you have to try some of these things because it's no longer giving you the pleasure that you used to get from it.
Exactly. When I quit, it was purely discipline. And it was really a struggle every day, if I'm being honest. Had it for quite a few weeks or months even. And I had to do a lecture. And it was a week where my kids were ill. And I think I slept maybe 8 hours in 3 nights. And I thought, I cannot do this. I don't know how I'm going to do this. So I thought, well, okay, how bad would it be if I would just have a little bit of coffee? And so I actually drank like even half a little cup. It was maybe this amount. And I thought from that point, never again. I started shaking. I started sweating profusely. I was really embarrassed, but I couldn't stop sweating. I had my cheeks, they were like super red. And I thought, no. And at night, what you're saying, like your nervous system is so triggered and it's so on. And I was in bed till 4 o'clock, like eyes wide open. And that was when I decided, okay, so never, never, never again.
Yup, exactly. I've been there. It sounds like you started to have some healing. Can you talk through maybe what that was like? And have you seen that with other patients as well that you've worked with? Because I think often people expect that they start the right thing and they feel better and better and better, but maybe sometimes there's like a bit of backtracking involved.
No, exactly. And I think that happens quite often in people's healing journey. So I think pregnancy is obviously something that can really increase your symptoms. And not saying this for any woman to scare them, because I also have patients that start in their pregnancy and they go throughout their pregnancy while doing the good things. And they actually even heal a lot of symptoms in pregnancy. So that's definitely possible. But I think from where I was at that point, it was too early for my personal situation. But also, I think even being in an accident or having a loss in your family or another traumatic event, I think all those things, they do impact us. We're not machines. And so we have to take all of that into calculation.
And even before you were pregnant, did you experience any detox symptoms when you started changing your diet?
In the beginning, not really a lot. So I think like knowing what I know now, I feel really blessed because I just could start drinking celery juice quite easily. Obviously, I did notice I had to go to the toilet a bit more, but also, I mean, you're drinking a lot of juices, so something was going on, but it was really actually not that bad at all for me.
How would you explain the timeline from when you started implementing this, the first changes to your diet to when you felt relief from, let's say, depression or maybe after your pregnancy, if you continued again? What would you explain that timeline as to someone who's hopeful and optimistic to relieve their symptoms?
Yeah. So I think for me, from when I really got into everything, so when I really started to implement all of the recommendations, within the first year, my life was changed dramatically, like day and night difference. And yeah, so I think within the first year was my biggest shift. And from that point on, then I had my son and a second son 2 years later, which was much better. I look back on such a positive experience, and obviously that's always draining on the mother, for your adrenal health, and you give all your best energy to your baby, which is normal. So I did got a little relapse of chronic fatigue, but actually it was such a big difference compared to my first pregnancy. So I really did notice I was already on this lifestyle for quite a few years at that point. So that really made a big difference. And I think from that point on, every year it progressed into getting better. And sometimes I even healed symptoms of which I didn't really, I never really acknowledged them as a symptom. So, for example, like receding gums or sensitive teeth, or I didn't know this could heal. I mean, I knew it after reading all of the information, but from my dentist, it was something that would remain the same. So every year I've improved, but it's not always, sometimes it were big changes, sometimes they were small. And that's what I still notice. And so every year that passes, it's better for me than the year before. And I think that's a really good tendency if I just keep that going. But then again, if you would ask me, like, what is normal for you right now? I think now I work more than full time. I take care of my 2 kids. I work out pretty much every day. I take care of my dog. I have a husband. So, I mean, I never expected I could do this much.
I can't believe you just said that you work out every day. How do you fit that in and what do you do for workout daily?
Yeah, so what I do now is not what I started with in the beginning. So I'm a big morning person, so I wake up quite early, usually like 6 a.m. And then We start juicing it for a bit, and then I immediately start doing my workout because that's the only time for me to fit it in. If I do it later, I have difficulty falling asleep. So that's really a necessity for me. And so I do CrossFit, I do yoga, and we have a treadmill that I use. So I think that's really simple, but yeah, that's what works for me. And I just do 30 minutes, but that's what I can practically do and what I can keep on doing consistently.
That is so inspiring. And do the kids join you, or what are they up to at 7 a.m. when you're working out?
Yes, they are early risers as well. They would constantly need my care and my attention, but I just embraced that. And I thought, well, at some point, they will be able to do more for themselves. But also, I think it's good to model that you, as a mom, you also take care of yourself and you show them that exercise is something that matters. So fast forward to where we are now, they will just start playing together or do something, or actually they really like to help juicing. And so my husband likes to do the juicing in the morning. So they will just entertain themselves, and sometimes they will come and they will talk to me. And usually my youngest son, he really likes to, when I'm doing a CrossFit type workout, we bought him these little weights so he can join me. And I think it's so cute.
That's amazing. I am so inspired. I'm literally going to replan my mornings right now.
Yeah, we do have a pretty strict morning routine, but yeah, it works. And I think that's really helpful for me.
Yeah. And I want to touch a little bit on sleep because I know sleep is such an important thing for health, but in crunch times when you had kids or were working, you were still able to heal progressively over time. So I think that's really inspiring to hear. But at this point in your life, where do you see sleep in the level of importance for healing?
I think it's one of the top priorities. I mean, if you don't address underlying causes, for example, low-grade infections that could cause your symptoms, sleep purely will probably not cure that. But I think it's really high on my priority list. Even as a person that has suffered with insomnia, there's a lot of pressure on good sleep and, like falling asleep before 10 p.m., that would be the best, or we need 8 hours of sleep. And I think sometimes that can create so much pressure for people. I could never do that, and it always made me feel really bad. So I think what can be really important is also just embracing where you are at this point and just see if you can gradually increase your sleep quality or your sleep duration or however it works. But even in cases where people get very little sleep, if you do the right things, in my experience, they're more equipped to carrying themselves and performing what they need to do throughout the day. Because when your brain is receiving plenty of mineral salts and it receives what it needs, people still feel replenished and refreshed. And if you still work on causes like healing your adrenals or your nervous system or other things that will keep you from your sleep, even toxic loads or like food additives can cause insomnia. If we continue working on that, then still people can get to a point where they can fall asleep more easily.
That's really inspiring and good to hear because I know insomnia is such a challenge for people because you might address some of the basic known things like turn off the lights and things like that, but often that just doesn't do enough to resolve the symptoms, and it can be very stressful, like you're saying.
Yeah, I think actually not being able to sleep, as I've mentioned, at the end of my first pregnancy, I just didn't sleep for days. And you literally feel like you go crazy. So I thought probably I'm not prone to getting psychosis because I would have gotten it because I was so sleep deprived and you're just not yourself anymore. And I think that can be really difficult. I think that was probably one of my most difficult things, everything considered.
That is so scary. And you're saying that the diet that you implemented, the medical medium based diet, has actually really helped you to resolve these chronic fatigue symptoms
Yes. So
or
I
insomnia symptoms, I should say.
both. But yeah, I think so insomnia that didn't resolve as quickly as I wanted to because yeah, after the pregnancy of my first son, yeah, I slept really bad at the end of it. And then obviously you're wide awake after having a baby. And there was also quite a bit of trauma due to hospitalization I needed. So I had a lot of nightmares afterwards. So either my son was waking me up or I was lying awake with a lot of nightmares. Yeah, so I really had a fear of going to sleep. So I think that was really a difficult thing at that point, which slowly improved. And then I got pregnant with my second son. And luckily that wasn't traumatic at all. But still, you're really like hypervigilant, and every breath you hear, I mean, I think many parents can relate to that. So it took some time for my nervous system to calm down again and to just to realize like, okay, my kids, they're fine. I'll hear them when they need me, and just it's okay for me to fall asleep. But I think also, yeah, the medical medium style diet that really helped me also to calm down my nervous system and to actually also achieve a deeper sleep quality.
And did you try anything else aside from diet-based solutions to deal with things like, PTSD and fear and other factors like that? Did anything else help you?
Yeah, so I also had some previous trauma even from before the childbirth. So I did have a psychologist who did EMDR, and I think that helped really a lot, whereas it wouldn't impact my daily life. But somehow you feel like there is still something inside of you that remembers that. And I think it's difficult to put this into words, because when we experience something traumatic, our body creates a lot of adrenaline. Actually, that emotion can be attached to the adrenaline, and when we store it, the emotion also stays in our body. And I think the EMDR is more like a cognitive thing. So you don't have specific remembrances or you don't have nightmares, but your body still knows what it has went through. And I think after implementing these diet style changes, I think my body really was able to let go of all of that.
Wow. Can you explain a bit more about that technique that you were just describing? I'm not familiar with it.
Yes, oh, sorry. So there is this specific technique that psychologists can do, and I think it's called a rapid eye movement desensitization. And so what they found is that if you use a specific part of your brain, like your working memory, and you can use that by, for example, they ask you to follow their fingers and you have to keep looking at that with your eyes. So your brain is engaged. And while doing that, you have to, for example, you have to spell words, or you have to spell them backwards, or you have to make some calculations. So you're really occupying your brain. And during that process, they take you back to a traumatic event, and they keep taking you back to it and back to it. Somehow our brain cannot both store traumatic memories and have this activation of our working capacity. So you do this over and over and over again, which is really difficult because you relive the trauma and the most difficult parts of the trauma continually. But if it starts with a 10, and then after a few cycles, it's at a 7, or if it's at a 6, then that's already a big progress. And they just continue doing that technique until you can think of what happened, so you don't forget it. You still know what's happened, but somehow it doesn't evoke an emotional response anymore.
Wow.
Yeah, I think that has helped me a lot as well. And this is something that's regular medicine as well. And so I think it's also good to keep in mind, like, this can be really helpful for people. But yeah, people do have to be prepared for it because it's quite a difficult and quite an exhaustive process.
Wow. And that makes me think also of hypnosis. I know it may not be the same thing, but can you explain a little bit about what you learned about hypnosis and something that I've always wondered, because I've seen, hypnotists hypnotize people on a stage, but then there's so much that people learn to hypnotize themselves for healing, and I can never quite understand what that difference is or what that would feel like to hypnotize yourself. Maybe I've even done it and I don't even know, but
You've been under hypnosis more than you're aware of. So I think this is something, it happens continually. So it's in marketing ads, it's in sort of sounds, it's in certain things that we get told, like you need this, or so it's everywhere. But I think there's things that show hypnosis, and I think that's probably what you're referring to, which has little to do with what you can do as a hypnotherapist. I mean, every hypnotherapist learns to do like rapid inductions and like make people go, all of a sudden they fall asleep. And I think you can compare it a bit to sort of a really relaxed meditative state. So that's how it feels. And you can come out anytime, but you just want to stay there. And I think then what a good hypnotherapist will do, they will try to change something or some sort of association in your brain. So usually by either using a metaphor or telling a story or like doing a different technique where you visualize a different outcome, for example. And that can be really helpful for people. So it's actually sort of like a guided meditation, but then it goes maybe a little bit deeper.
Wow, fascinating. And I do feel like that's something that I probably have experienced. Like, even if you're giving birth and things like that, the state that you go into, it must
Yes.
be some level of self hypnosis.
Exactly. And I think so that would be a formal session. But even if a doctor tells a patient you only have 4 months to live, that's actually also a form of hypnosis because it's something that you take it in your mind. And that is something, that is now your new reality. There have been studies done where if people don't know what their prognosis is, they actually tend to live much longer, whereas the actual patient features would be the same. They would have, for example, the same severity of disease. So it's in little things. And so if a doctor tells a patient like you have a severe pneumonia, or if they would tell you you have a lung infection, for example, sounds really different. And I think that's what can be, and maybe that doesn't sound impactful, but I think especially also in kids, it can be really helpful, and they're much more open to it because they don't have this critically thinking mind like we do. But even adults, they can usually go past that. And if you can tell people, well, what you'll feel this doing, that is actually already a little bit of hypnosis, because then their unconscious mind, they will start to focus on everything this intervention, for example, food intervention, will start doing for them. And it's in these little things that we can use that to our advantage without having a formal hypnosis session.
I think that's a great segue into how have you managed to integrate some of the beneficial practices that you found for yourself into your conventional medicine practice? And maybe if you could tell a bit of the story of how that evolved for you as a doctor, how that career shift happened and how it plays out today.
Yes. So in the beginning, I started for myself because I just wanted to heal and I wanted to have a family. Along the lines, my patients saw me change. They saw me healing, my complexion, my hair, your whole energy. It changes when you heal. So people started asking me, like, what are you doing? To some people, I could explain it for a little bit and they get curious because I think also in the Netherlands, a GP is quite a prominent doctor for people. So you, for example, that's always the first doctor you go to. You cannot immediately say, I would want to go to a gynecologist. You would always see your GP first. So they're really quite involved in my country. So we really do know our patients. We know families a lot. So yeah, they would happily ask those questions. Some of them were interested and they were like, well, can you start creating a plan for me? And more people requested that. So I started talking to my colleagues. So I was working in a regular GP practice with two other GPs. So I discussed with them, like, how do I navigate this? Because not everything I want to recommend these people is evidence-based, but in my experience, it does really work well. And it's not like I'm recommending like harmful things. It's like who would not benefit from, for example, having a fruit juice or for example, a celery juice or a cucumber juice. They were actually, they were quite okay with that. And it's just like, yeah, well, we have faith in you and just do what you're doing. But what we noticed is over time, more people wanted to have these consultations and it started to create difficulties with scheduling for our regular consult. Then, for example, if somebody would contact because their kid had a severe ear infection, I wouldn't have any room in my calendar anymore. So in the end, we sort of had to agree that this was no longer working. And yeah, so we actually, in really good terms, I left the GP practice and I started my own practice in the city center where I just only did these lifestyle consultations. And I think from the beginning, I mean, it was quite scary because obviously I was in a and everything. I was well settled in the other practice and everything was working out. But yeah, quite quickly, my calendar filled up again, and many people by word of mouth recommended. And then some doctors started recommending me because I've worked with them in emergency room shift. So it's quite a small world, obviously. So people know you and they know you're not maybe I am, but not like a weird person, like doing crazy things. I mean, probably some people will think doing a lot of juices is crazy or like making a specific smoothie. But then again, so they did have a lot of confidence and they even acknowledge the results. So still there's quite a few doctors that recommend patients. And that's how it started. And when I began, I thought, well, if I can grow my practice probably in 5 years, I'll be really happy. But actually, within the first half year, I had a waiting list. And that's still the current situation.
Oh my gosh. I mean, that's really exciting, but also, what do you think would be the ideal state of the healthcare system where people could get both, let's say, urgent care for severe earaches, but also lifestyle consultation, perhaps in the same practice or in a way that's not building up to a situation where people can't see you because you have a wait list? What do you think would be that ideal situation?
I think then we would need a lot more doctors because in the GP practice, we had about 10 to 15 minutes to see a patient, whereas now, if it's a regular consultation, I take up to an hour. So you would need so much more doctors, and I doubt that would be immediately something that they could implement. And also, there are sometimes difficulties with health insurances. Because if it means that they have to change the current system, that makes it a bit more difficult. So, I mean, personally for myself, now I only do this sort of lifestyle medicine consultations because I feel like there is other doctors that can see a child when he has an ear infection, just to stay with that example. And so I'd rather focus my time on the people who want this type of care because there's not that many doctors, at least where I'm from, that do this.
I think everywhere there's not a lot of doctors like that.
Yeah. So I've positioned myself in a way where people keep their own GP and they go there if there are urgent infections or if they have pain from a kidney stone or whatever. So they visit their own GP. But when it comes to like more like chronic care and taking care of chronic conditions and underlying causes, that's where I come in. And usually I do communicate with their GPs as well. So if there's something, or if I think like, well, we've been working on this patient's thyroid and this is what blood work shows. So I would recommend now to lower the dosage from this to that. Usually, because intercollegial relationships, they follow that up. And I think in that way it works really well.
So I saw online some pretty inspiring stories that you've shared on social media of healing from your patients. What would you say are the most common conditions that you are presented with? And what are some of the exciting or really inspiring healing stories you've seen?
Yes, so I think what I see most is people probably with fatigue and with eczema. And with some conditions, it's difficult to put that in a visual image. Yeah, for example, if somebody has less fatigue, it's difficult to show. Yeah, but I see a lot of people with eczema. You can see that quite easily because it's on the outside. Alopecia is something that's really easy to visualize. And I think I have seen so many things I thought could never heal. I see people in their 80s getting off of their prednisone medicine because of rheumatoid arthritis, which I never figured there could be a cure for. Even people I had a lady who had colitis. We called it a pancolitis because it was throughout the whole entire system. And I never saw inflammatory markers that were that high. And fast forward a few months, they were so low, the lab couldn't even measure them. And I actually recently talked to her again, and they remeasured it, and it's still incredibly low. So I think I'm shocked every day as a doctor with what can happen with people. So I think that's really also what motivates me, that keeps me going. People that have been on the couch for years and they get up and they start going back to school or going back to their jobs. And that's always what really gives me like goosebumps because that's what exactly what I've experienced, that is what I want other people to have.
Absolutely. I saw one picture of someone who had recovered, who had healed their varicose veins. Now, is
Yes.
that true that varicose veins can actually heal?
Yeah, so actually, it's not something that I see quite often. I'm going to be honest with that, but they can. And I think it's all coming down to like, what is the underlying cause of it and what can we do for it? And I'm actually amazed with what our bodies can do when it's given the right tools. So sometimes I don't even know if something will heal. I'll explain this to patients like, I'm not 100% sure, but I think let's just go for it. And whatever else, you might have some side effects of more energy and your weight and or whatever else they suffer from. I think that inspires me a lot, and it might not sound that impressive, but for example, patients with fibromyalgia, there's not really a regular cure for it. And people, they are told just to live with it. And I think with this diet, it can be so life-changing for people. I have patients that were invalidated and now they can move again. They can move back to work again. If you ask me like what's also as a doctor, I've been taught that, for example, osteoarthritis, which is a degenerative disease, it cannot change, it cannot heal, yet it can. And I think that's, yeah, and I've seen it with things like autism that can improve. I've seen it with MS patients that have, like, they're being diagnosed with damage and lesions that the neurologist says, well, this will probably remain for the rest of your life. And with doing the right tools, it can resolve. And that just makes me silent. Yeah.
So exciting and so inspiring to hear. What would you recommend to someone who's in the thick of it right now with a severe chronic condition, any of the ones you mentioned or any of the ones out there, as like a first step or to give them hope that, they can do something right now?
Yeah, I think one of the main things is to always have hope. So your body, it knows how to heal itself. It needs the right tools and it needs what it needs. And I think oftentimes what the body needs is to lower certain pathogens in our body. So it can be helpful to find a practitioner that can help you with that. If people are able to dive into the book series of Medical Medium themselves, Anthony William, and I think that can be really, really helpful for patients. And even starting like really small changes. For example, when you wake up, do 16 ounces of water with the juice of half a lemon or half a lime squeezed into it, and then just wait for a little bit. And people even notice changes from that. And if they can do more, I mean, obviously, celery juice is always a great starting point. And mind you, it has to be pure celery juice. I mean, I know it tastes better if we add apples or other exciting fruits to it, but it actually, it is in the simplicity, and it's just plain celery juice because it's in a way that our blood and our lymph and our liver and every other organ can absorb it so easily, and it can start doing its magic. And I think what also can be really helpful is every organ has certain ways of working. And our liver, for example, it works best in the morning. So it can do its biggest job in the morning. So I think it's really helpful if we don't clog it with a lot of fats or a lot of salts in the morning, because our liver cannot both digest fats and salts and detoxify. So if we want to maximize that window, and that's a recommendation I give to all my patients, is to omit fats for at least the morning up until like 11 or 12 if possible. And doesn't mean they cannot have fats whole day, but at least lowering them can already be so helpful.
And have you ever faced skepticism from people on, let's say, methods that are recommended by Anthony Williams or on dietary treatments that may not be fully proven yet from a conventional medicine standpoint? And how do you address that, or how do you maybe bring in the information that is known to help convince them that there is some benefit here?
Yeah, so that's a good question, because there can be some skepticism with patients. Also, because sometimes it's not like taking an antibiotic. It's not like if you do this for a week and all your symptoms will be gone. So I've been on this for years, and like I said, I even continue to notice improvements every year. So if I would, for example, wait for the healing for one specific symptom that took me, for example, much longer, And if I would, after 3 months, conclude like this is not for me, I think it's important that people sort of feel aligned to a method and they can sort of surrender to it. Like even if we don't notice something immediately, know that it's doing something for your body. And to be honest, now I'm in quite of a luxury position because I do have a waiting list. So people that do have appointments, they really thought about, to see me. And so it's not something I encounter quite often, but sometimes when people are doing the right things and even healing takes quite a lot of time or symptoms are persistent, it can be difficult. And I always try to point them to like it's maybe you're focused like mainly on your fatigue right now, or you're mainly focused on your weight right now, but look what has improved. So I also always make a list of symptoms when people begin working with me. Sometimes people have 7 symptoms and sometimes they have 65 or anything between. There are people that have over 100 symptoms, and I think as long as you see some things changing, you're heading into the right direction. And I think that can be really motivating and helpful for people, because it might sound stupid, but if you always have, for example, nightly cramps in your legs, for example, many patients suffer from that. Once it's gone, you forgot you have them. Well, you have them, you think, oh, I'm never going to forget this. This is so annoying. And actually, when you started asking me about my own symptoms just in the beginning, I was like, well, what did I, oh, wow. Oh yeah, I almost forgot. And I forgot how debilitating it was.
That is so true. I've experienced that so much. I forgot how bad my eczema was.
Yes. And then you get a flare up and you think like, what happens to me? How did I go do life with all these symptoms?
Right? Speaking of how do you do life, so how do you actually manage to incorporate making fresh juices all the time? How do you actually implement this for your kids as well? And like, what do you pack for school lunches? And how do you make everything from scratch fresh? Because it's very challenging to figure that all out and fit it in.
Yeah, it's definitely a challenge sometimes, but I think what has helped us most is that I was already in this routine when my kids were born. So my kids always saw me drinking green juices. They always saw me doing smoothies, eating a lot of fruit. So when they were babies, they were like doing like wanting to have a sip of celery juice, for example. So I think it was something that was really natural for them. And obviously, when they are like 2 or, it can be they start to refuse things, but then we always try to encourage them to do it. And all of a sudden, it was in their routine as well. And because I already had to make some things for myself, then I thought, well, might as well do it for them as well. But sometimes it can be quite a challenge to figure out what works. And I think it's more difficult if you have kids that are already used to a certain lifestyle and then have a change that's implemented. But in terms of school lunches, so I usually ask my kids what they like best. And we have this really simple banana bread and they love it and they cannot get enough of it. So we just give that to them every day and we switch that up with can be some nuts or it can be some seeds or it can be raisins or some fruits and vegetables. And they like to eat a lot of apples and fruit. So we always have a fruit moment at school and where they would have their sandwiches and then they would have their banana bread. When I talk about this, especially with my oldest son, and I asked him like, do you ever feel like you want something else? Or how do you feel comparing to the other students in your class? And then he starts laughing and he's like, Mom, I have the best lunchbox. That's so cute. So I think I'm really blessed with kids that like everything that we give them. And obviously sometimes they always have things they like best but they really adapt to this lifestyle quite easily because they never knew anything else. The other day, my eldest son, he played at another kid's house and the mom asked if he wanted orange juice. So we always drink fresh orange juice. So he never tasted anything from a carton. So and he was like, this is not good anymore. So yeah, so he's actually like, no, what we have at home is much better, Mom. So yeah, I think actually now it's really easy for us. Maybe, probably when they will be adolescents, they will start to want to do other things. But then again, hopefully then, their taste buds are developed in a certain way and, they will at some point when they have had that phase, hopefully revert back to a more natural way of eating.
Absolutely. You've given them that base. My family also raised me eating a lot of like fresh fruits and vegetables. And of course, I ate whatever I wanted in college, but I got to a point where I started craving a lot of fresh fruits and vegetables again. I started just eating spinach out of the fridge, and my husband would be like, "What are you doing?" So your childhood habits like help you later on.
And I also think that people sometimes think like, oh, but you should enjoy life. Why would you eat this type of way? But they forget like your taste buds, they do really change. And if you're not used to all these artificial flavorings and lots of salt and lots of sugar, like my husband will still laugh at me. So sometimes I can just eat a plain steamed potato and be like, oh, this is so good. And it's like, oh, what are you saying to me? Like, this is crazy. But then, yeah, if your taste buds are that pure, I really like everything I eat. So it's not difficult then. And so hopefully, I think that's what will happen to kids as well.
Absolutely. What do you do when you are traveling or going on vacation? Do you pack everything or try to just buy locally, or do you ever make exceptions?
Yeah, that's a good question. Usually, mind you, my kids are still small. What they like best is when we just have our own house and with a kitchen. This is sort of separate from the lifestyle recommendations, but one of my sons is actually severely allergic to some of the foods I don't recommend people to eat. So he's been in anaphylactic shock in the hospital after being exposed to that. So eating out is quite difficult for us because he has it with nuts and he has it with eggs and he has it with some other things. So it's really difficult. Sometimes you can tell people don't do this, but then they have something else that's in there. So yeah, we usually either cook ourselves and we have our own home and we just bring a blender and a juicer. Yeah, at this point, it's in our routine and we feel really happy about it. But sometimes if you have a good hotel where you actually can trust the cook, then it can be done. But yeah, and then we usually, depending on if we, for example, would fly somewhere, we bought this cheap little slow juicer that fits into a suitcase, and we just leave it there. I know it's probably going to be broken at some point because they throw with the suitcases and everything. But then, yeah, at least we can do something, and we try to find something locally or find a juice bar or whatever is there. So yeah, it's a little bit of adapting sometimes, but actually we always manage to find something.
That's really inspiring. I wanted to touch a little bit on the book that you have written. Maybe if you could just describe a little bit what inspired you to write that book. And is there anything around, let's say, spiritual work that you ever recommend to your patients? If, let's say, diet alone is not really showing a lot of impact, is there another element that you sometimes refer to? And is that connected to your book?
Yeah. So to answer your last questions, so I always try to look at a person in a holistic way. So I don't just ask about their symptoms. I ask about their family, their life, their hobbies, their dreams they would have for their future, like what what they're like morally. So all of those things I ask my patients so I can really see like what is something they might need guidance on or they would need. And for some people, spiritual work can definitely be a very important aspect of that. And I think regarding your question about my book, so as I've mentioned, I suffered from depression ever since being a young girl. And but I also had these experiences where I was guided to beautiful things. And what was really, really difficult for me is how can both exist at the same time? So how can I have a connection to sort of a world of light in which everything is beautiful and lovely. Yet also now I am here on earth and having this experience, which is day and night difference. So that was really like sort of this duality. That was really a big, big struggle for me. And this was actually, I wrote this book before I started on this health journey. And yeah, so I try to describe my own process of what it was like for me to deal with that and also what I did to not suffer from that so much. And I think what has helped me a lot is that both of them can be there at the same time. So it can be really difficult and it can be really beautiful at the same time. And sometimes you can also, if you look at it from a broader perspective, more like a heartfelt consciousness versus an ego-driven consciousness, you can feel like all the difficult things that happen in your life, they can also be a blessing. And we don't feel that in the moment. And when I just talk to you about all of the symptoms I've had, like even now I'm thinking, oh my God, this was quite a lot. But then again, I think I would have never been able to be a compassionate doctor or to have, I think I would barely judge somebody because I think, well, I've been in places I would have done anything if it would have resolved. So, and I think I wouldn't have been able to have that in me if I hadn't suffered myself. So I think there can always be a blessing in something rather than just fighting something in the moment. Even when you're going through adversity, why not be grateful for it? Because we know it's going to bring us something. It's just we have to be willing to view it in that way.
That is so inspirational, and I'm fully aligned with what you're saying. How did you get to that point where you had these realizations around, let's say, heartfelt consciousness versus ego-driven views of things? How did you reach that point where you had that realization?
Yeah, so during some of my episodes of depression, so I would always sort of try to escape these feelings of depression. So I would always focus on like happiness and light. And while chasing that, I sort of denied that the other thing was there and I couldn't accept it because I didn't want to accept it because who would want to accept like very negative, dark feelings? So at some point, there was so much suffering and it accumulated to a point where it was so intense. I couldn't do anything else than just allow it to be there because I couldn't fight it anymore. I was in our attic and I just laid there and all of a sudden I lied there and I was like, wow, yeah, this is really peaceful actually. And from that point on, I mean, I wasn't completely healed, but there was so much acceptance around everything. And yeah, that really did shift a lot for me. No, there's a difference between there. I think there's really acceptance can be really important for people, but then again, not to a point where you're not inspired to take action. But I think you can take action out of a way of I don't want this, fight it, or you could also enter something like, wow, this really doesn't align with what my greater self wants to do here in this world. So maybe I start making some changes because you actually feel like it's something you need to change on, as you explained with you quitting coffee. Like it was sort of an intuition driven thing. Whereas when you wanted to do it with your ego more, and you're like, no, I have to do this. This is not good for me. I don't want this. It was more difficult. But actually, when you allowed it to unfold in a way that I'm not choosing this anymore, all of a sudden it does work. And I think that's what can make a really big difference.
These are really difficult topics to explain, but I feel like you're doing such a good job giving these examples to kind of be insightful about it because it's sometimes hard to put these subtle concepts in words of like, you're not fully just accepting everything as it is, but you're stopping resisting the parts of it that you can't control in the moment and being open to what you could do to change as opposed to fighting it all the time.
Yes. Yeah. And I think even when I wasn't physically healed, I think this type of consciousness, this more of like heart driven consciousness, I think that helped me so much and it made everything much lighter to go through. And even then, I still had some moments of like feeling really bad or feeling depressed. I would sort of be able to, yeah, which sounds really crazy, but sort of welcome it and just like, okay, this is it, and I'll just embrace it for now. And then I also noticed when you embrace it and completely feel it, it can just leave you again because you felt it, and then it's so much more light.
Given the state of medical research and conventional medicine as it is today, and your experiences healing both, let's say, from a dietary perspective and also from a spiritual or mental or consciousness perspective, what would be your ideal recommendation or hope for the direction of research or for the direction of how the healthcare community could change and evolve in the near future?
I think what we really need to focus on first is understand that we are just addressing symptoms and we're mainly not treating underlying causes. And also, so I think that would be one of the big things. And also I notice a trend in healthcare that everything is so specialized. So you don't just have a cardiologist, but you have a cardiologist that's specialized in valve repairs or and if I ever would need one, I would be happy to have that type of specialist. Just being honest about that. But I think where are the doctors that have a complete overview of people? And even when I was a GP and I thought I had really good connections with people, sometimes I would see them after in my lifestyle practice. And then I would talk to them, and all of a sudden I thought, wow, I never knew this about you. And this makes so much sense. I now understand why this would happen and that would happen. And I think like having a holistic view of somebody, it's not just their physical health, but their physical health is impacted, but if they feel a purpose in life or if they what challenges they navigate, that's something we could really all benefit from.
Absolutely. Is there anything else that you would want to share or that maybe I didn't touch upon?
No, I don't think so. I think one of the main things, but we did discuss that, is just for people to know that there is always hope. And I think that's, you know, our bodies, they really want to heal and they want to be helped. They just need what they need. And when they're given the right things, they can just start changing. And some people can feel so much anger towards their bodies where I think, wow, you don't even know how hard your body is fighting for you. And they think, well, but I still have these conditions. But they would have been so much worse if their body wouldn't do all this effort. So I think it's also showing your body grace and wanting to take care of it because it's such a special thing and it works for you day and night, every day. And yeah, I think it's honoring and respecting that also subconsciously will probably improve your healing process or accelerate it because our bodies just, yeah, they fare well on a loving energy.
So well said and so inspirational. Everything you've said has been really informative. I loved hearing your story and how you came from a pretty difficult place with a lot of chronic conditions and have come to a point where you are better than you've ever been before and healing others. I really appreciate you taking the time to share this whole story.
Yeah, well, thank you so much. And also thank you for doing this work because I think it's so important what you're doing and your mission. So yeah, thank you for what you are doing.
Thank you, and I would love to stay in touch.
Yes.